Birth Control and New Technologies, presented by Taryn and Brittanie Waldon. What is birth control? According to Planned Parenthood, birth control is a safe and easy way to prevent pregnancy. A few birth control methods, tools, and medications include the implant, patch, pill, shot, sponge, vaginal ring, cervical cap, diaphragm, condom, the female condom or FC2, fertility awareness method or FAMS, IUD, spermicide, men's sterilization or vasectomy, and sterilization, Essure or tubal ligation.
Some new methods for women for birth control include the natural cycle of fertility/birth control application and the Annovera vaginal ring. For natural cycle, it is an algorithm that measures the user's morning basal body temperature with the thermometer, and then the user inputs their temperature into the app, and then the app reports whether they're fertile or not. If they get a red circle, that means they are not fertile, and if they choose to, they do not have to use protection. And it reports a red circle if the user is fertile, and then the user can decide whether to abstain from sex or use protection. As for the Annovera vaginal ring, it is a new hormonal vaginal ring that is the first ring that can be used for up to a year. The ring is placed in for 3 weeks and is taken out the fourth following week to allow menstruation, or it may cause withdrawal bleeding. The science behind natural cycle is after ovulation happens in the menstrual cycle, there is a detectable rise in basal body temperature caused by hormones. Basal body temperature, or BBT, is the body's lowest resting temperature, which you can measure first thing in the morning when you wake up. To measure this small yet significant rise in BBT, you need a thermometer which shows 2 decimal places. As for the Annovera ring, the ring is left in place for 21 days and removed for 7 days in each cycle. It provides contraceptive efficacy up to 13 cycles or 1 year of use. It is designed to release 150 mcg progesterone acetate and 13 mcg ethanol estradiol per day and has a Pearl index or failure rate of 2.98. The effectiveness for natural cycle has two effective percentages based on how users use them. For perfect use, it is 98%. Perfect use is when you do not have unprotected sex on red days. For an example, always use a condom or abstain from sex. To be a perfect user, you do not need to measure every day at the same time, but you do need to use protection on every red day. Perfect use also includes women who had unprotected sex on green days that was falsely given or had protected sex on a red day but method failed. For example, is a broken condom. Also, according to Natural Cycle, the analysis looked over the data for over 15,000 women. When calculating typical effectiveness in this study, all possible reasons for becoming pregnant while using Natural Cycle were taken into account. This includes having unprotected sex on red days, to the app wrongly given a green day, or a failure of a barrier method. The second effectiveness rate is typical use, which is 93%. Typical use shows how many women on average get pregnant due to all possible reasons. The most common reason for pregnancy with natural cycles is failure to use protection on red days. Typical uses include pregnancies that occurred under perfect use. 93% effective under typical use means that 7 out of 100 women will get pregnant during 1 year of use. The effectiveness rating for the Annovera ring, according to the FDA, the efficacy and safety of Annovera were studied in 3 open-label clinical trials with healthy women ranging from 18 to 40 years of age. Based on the results, about 2 to 4 women out of 100 women may get pregnant during the first year that they use Annovera. According to endocrine.org, their rating is 94 to 98%. This rate means that only about 3 unintended pregnancies occur per 100 women in a year, compared to a Pearl index of 80 in couples not using a contraceptive method.
New methods for men: 11 beta MNTDC pill, The experimental male oral contraceptive is a modified testosterone that has the combined actions of a male hormone and a progesterone. Still in the testing phase, when healthy men use it daily for a month, it produced hormone responses consistent with effective contraception. Nesterone testosterone gel. Topical gel, when applied to the shoulders and back, combinations of testosterone and nesterone may suppress spermatogenesis and prove appealing to men for contraception. The science. This pill, which combines two hormonal activities in one, will decrease sperm production while preserving libido. Among men receiving 11-beta, the average circulating testosterone level dropped as low as in androgen deficiency, but the participants reportedly did not experience any severe side effects. The progesterone in the gel, which is meant to be applied to the arms and shoulders every day, works to shut down the gonadotropin hormones responsible for stimulating testosterone production in the testes. When you lower the testosterone in the testes, testosterone levels in the blood also drop, and that can lead to nasty side effects like low libido or problems with ejaculation. So how effective is this? Among men receiving 11-beta, the average circulating testosterone level dropped as low as in androgen deficiency. Because the drug would take at least 60 to 90 days to affect sperm production, 28 days of treatment is too short an interval to observe optimal sperm suppression. In a 24-week study published in 2012 and funded by the National Institute of Child Health and Human Development, the gel suppressed sperm levels in nearly 90% of men to 1 million per milliliter or less, the amount needed to prevent pregnancy, with few side effects. And how do these connect? In females, FSH and LH stimulate the ovaries to secrete estrogen and progesterone, hormones that stimulate the development of female secondary sex characteristics and control the menstrual cycle. In males, FSH and LH stimulate the testes to secrete testosterone, which stimulates sperm cell production and the development of secondary sex characteristics. As a note, these devices or practices reduce, if not eliminate, the chances of egg fertilization, which is pregnancy. Compared to 25 years ago, birth control technology for women has vastly improved. The oral contraceptive, the IUD, and improved techniques for abortion and sterilization have presented better prospects for safe, effective birth control than have ever before existed. The male contraceptives are still in the testing stages, and there isn't one approved by the CDC for human use. This concludes our presentation on birth control and new technologies and how they connect with the Module 14, the endocrine and reproductive systems. Taryn and myself have included the sources used along with the textbook to gather information presented here today. Thank you.